Welcome to our deep dive, everyone. Today we're going to be tackling a topic that I think is so interesting, exposure therapies. It's
Yeah,
almost like this idea that if you confront your fears head on, that could be the key to actually overcoming them.
it is fascinating, isn't it?
It is. And I think it's something a lot of people have probably heard of, but maybe don't fully understand, all the different approaches that fall under that umbrella. So that's what we're diving into today.
Yeah, and we've got a great selection of source material to work with on this one.
We do. So we'll be exploring everything from uh, using vivid imagery to kind of tackle those fears to more structured approaches like prolonged exposure and even EMDR.
Which, yeah, even involves eye movements,
Mhm.
right? It's
Yeah.
really interesting stuff.
It is. And I think the big question here is, avoidance, right? We
Yeah.
naturally want to avoid the things that scare us. It makes sense. But what if that avoidance is actually making our anxieties worse over time?
Right, that's the real crux of it. It provides that temporary relief, but it sort of traps you in this cycle of fear.
Exactly. So let's unpack that a little bit. And to kind of kick things off, I thought we could start with that really compelling story from the source material about Anik,
Oh, yeah.
the graduate student who experienced that terrifying burglary. I mean, that's a real life example of how this stuff can play out.
Absolutely. And she went through, a pretty standard course of therapy after that event. But ultimately, it was EMDR, the specific type of exposure therapy that really helped her find relief from PTSD.
Right. So even after traditional therapy, there was still something missing. And it was really that confrontation with the memory through EMDR that allowed her to finally process that trauma and, regain control.
It highlights how powerful these techniques can be.
It does. Okay, but before we jump too far ahead into all the modern approaches, I think it's helpful to understand where this all started.
Right.
Kind of go back to the roots.
Definitely. And to do that, we need to look at implosive therapy, developed by a therapist named Thomas Stamfel. And he had this really interesting perspective. He believed that avoiding our fears is at the core of so many psychological struggles.
So basically, he saw avoidance as the root cause.
Exactly. He viewed our symptoms, our defense mechanisms, all as learned avoidance behaviors. And every time we avoid something that makes us anxious, we're essentially reinforcing the idea that it's dangerous, even if it's not.
So it's like, even if rationally you know that, whatever it is isn't that big of a deal, by avoiding it, you're telling your brain, nope, this is bad, stay away.
Yes. And you get stuck in that cycle. That's the neurotic paradox Moore talked about, that short-term relief ultimately leads to more suffering in the long run.
It's like you're digging yourself deeper into that hole of anxiety.
Precisely. And a great illustration of this, which was actually in the source material, was the case of the man struggling with intimacy
Right, yeah.
due to some childhood trauma. Like, even the thought of getting close to someone would send his anxiety through the roof.
Yeah, heartbreak.
And the natural response is to just avoid relationships altogether, right?
Mhm. It makes sense in a way because it protects you in the short term, but then, like we said, it just keeps that fear alive.
It does. And it prevents you from learning that, maybe healthy relationships are possible. You never get to challenge that belief.
Right. Okay, so implosive therapy, how did it actually try to break that cycle?
Well, it used really vivid, anxiety-provoking imagery. Essentially, patients would confront their fears head-on, but all in their minds. Like, imagine flooding someone with their anxiety, but in a safe space. They're forced to experience it without being able to escape.
Wow, okay. So it sounds pretty intense. Was it effective?
It's not as common these days, but it was really a stepping stone. It demonstrated the power of facing those fears instead of running away.
Okay.
And that paved the way for more modern approaches like prolonged exposure, developed by Edna B. Foa.
Oh, yeah, I've heard of prolonged exposure.
Hmm.
Can you tell me a bit more about Edna Foa? How did she come to develop this approach?
Well, it's a really interesting story. She started out very interested in psychoanalysis, but eventually shifted to behavioral therapy and research. And that research ultimately led to the development of prolonged exposure, which takes a more structured approach.
Oh,
So it combines a gradual exposure to the things we fear with response prevention.
response prevention. What's that?
It's essentially working to block those avoidance behaviors,
Yeah.
preventing ourselves from escaping the things that make us anxious.
So it directly tackles that whole cycle we were talking about.
It does. And unlike implosive therapy, which mainly used imagination, prolonged exposure incorporates both imaginal and in vivo techniques.
In vivo. So like real life exposure.
Yeah, so someone would gradually face their fears, both in their mind and in actual situations, and the therapist is there to guide them, starting with things that cause less anxiety and working their way up to more challenging ones.
Got it. So like baby steps towards facing those fears.
Exactly. And the key is preventing that avoidance,
Yeah.
blocking those escape routes so the person learns that they can handle the anxiety, that it's not as catastrophic as they thought.
It sounds incredibly powerful.
Yeah.
And, is this just for those big traumatic fears? Or can it be used for more everyday anxieties too?
Oh, absolutely. The source material even gave the example of a child who's afraid of dogs.
Okay, yeah.
A lot of parents, they intuitively use a form of exposure therapy.
Right, yeah.
They'll show pictures of dogs, maybe watch dogs from a distance, and eventually encourage the child to pet a friendly one. They're slowly desensitizing them.
So they're kind of getting them used to it in a safe way.
Exactly. And by preventing them from running away every time they see a dog, they're helping that child learn that dogs aren't always scary.
That makes sense. And I guess that same principle can be applied to things like OCD.
You got it. So someone with OCD who's afraid of contamination, for example, might be encouraged to touch things that trigger their anxiety, like doorknobs, and then resist the urge to wash their hands excessively.
Okay, so it's all about breaking that association between the object and the fear response.
Exactly. The person learns, hey, I can touch this doorknob and I'm not going to get sick. I can tolerate this anxiety without needing my rituals.
This is so fascinating. And I'm guessing, just like with implosive therapy, the therapist plays a pretty big role in prolonged exposure.
They're crucial. They're there to provide support, build trust, and keep the patient engaged in the process. They help the patient believe that facing those fears is possible.
So like that cheerleader in your corner, encouraging you to keep going.
Exactly. They're a guide, a support system, and a source of encouragement throughout the process.
All right, so we've covered implosive therapy and prolonged exposure. What's next in our deep dive?
Well, prolonged exposure is fantastic, but there are other ways to go about this. Up next, we're going to delve into EMDR, the technique that uses eye movements to help people process those traumatic memories.
Okay, EMDR. I've definitely heard of it.
It's really intriguing, and it has sparked some debate and controversy over the years.
Yeah, I'm curious to hear more about that.
We'll explore Francine Shapiro's journey in developing it, the theories behind it, and the key phases involved in this approach.
All right, sounds good. Lead the way.
Let's do it.
Okay, so EMDR. You mentioned it's been kind of controversial. What's the story there?
Well, the journey of EMDR is pretty interesting, actually. It all started with Francine Shapiro, and she, believe it or not, came from a literature background, not psychology.
Really? That's fascinating. So how did she end up developing a therapy technique?
It's a story of resilience and a bit of serendipity, honestly. She was facing a cancer diagnosis, and during her recovery, she kind of stumbled upon this thing that would change how we approach treating trauma. She was walking in a park one day and noticed that as her eyes moved back and forth, her distressing thoughts just seemed to vanish.
Wait, just from moving her eyes?
Yeah. It was strange, but she was intrigued, so she started experimenting, like deliberately moving her eyes back and forth while focusing on these upsetting thoughts. And sure enough, she found that they lost their intensity.
Huh. So that simple observation was like the seed for EMDR.
It really was. And, initially it was all about desensitization, just reducing the emotional power of those difficult memories.
Right, just trying to lessen the sting.
Exactly. But as she continued to work with it and refine the technique, she realized that EMDR was doing more than just lowering anxiety. It seemed to be facilitating a deeper level of processing,
Right.
bringing about these cognitive and emotional shifts that went beyond just making the memory less upsetting.
So it was actually helping people reprocess those memories in a healthier way.
Exactly. And, that's why the name changed from eye movement desensitization to eye movement desensitization and reprocessing. It was to reflect that more comprehensive understanding of what was happening.
Right, it was more than just desensitizing. Okay, I get that. But I'm still a little fuzzy on the actual theory behind all of this. Like, how does EMDR actually work? What's going on in the brain?
Well, Shapiro proposed that we all have this inherent information processing system that's always working to move us towards better mental health, kind of like our body's natural healing mechanisms, but for the mind. And trauma, she argued, disrupts this system. It causes information, especially those traumatic memories, to get stuck, like blocked in our nervous system.
So it's almost like having a file cabinet that's jammed shut.
Right.
And all the information is in there, but you can't access it or process it properly?
That's a great way to put it. And that blocked processing, that's what leads to the persistent symptoms of PTSD and other trauma-related issues. EMDR, with its focus on the memory and the use of bilateral stimulation, seems to help unlock that file cabinet.
Okay, I'm starting to get it. But What is bilateral stimulation exactly, and how does that fit into all of this?
Bilateral stimulation is basically any kind of rhythmic left-right stimulation, most commonly using eye movements. But it can also be tapping, hand tapping, or even auditory tones.
So the eye movements aren't the only way to achieve that stimulation.
Nope. They're just the most well-known method. And while the exact mechanisms are still being researched, it seems like this bilateral stimulation helps the brain reprocess those traumatic memories in a more adaptive way.
Interesting. Okay, so walk me through the phases of EMDR then. What actually happens during a session?
Well, it's a very structured process. The first phase is all about history taking and treatment planning.
Okay.
The therapist assesses whether the client is a good fit for EMDR, makes sure they have the resources and support to handle the emotions that might come up. Working with trauma can be really intense.
Right, it's delicate stuff, so you got to make sure the person is ready for it.
Absolutely. The next phase is all about preparation. The therapist explains how EMDR works, teaches some relaxation techniques to manage anxiety, discusses potential challenges that might arise.
Kind of like getting ready for a challenging hike. You want to have the right gear, know the trail, and have a plan in case you run into obstacles.
Yeah, I like that analogy. And once that groundwork is laid, we move into the assessment phase. This is where we identify a specific target memory to work on and the negative belief that's associated with it.
So for Neek, the target memory might be the actual moment of the burglary.
Yeah.
And the negative belief might be something like, I'm powerless or I'm not safe.
Exactly. And the client also identifies a desired positive belief that they want to replace that negative one with. It might be, I am strong, or I can take care of myself. And the therapist helps them rate how true this positive belief feels, usually on a scale from 1 to 7. Before starting the processing, that positive belief often feels very untrue.
Okay, so then comes the desensitization phase, the part everyone thinks of when they hear EMDR, the eye movements.
That's right. The client focuses on that target memory, the negative belief, any feelings that come up, all while following the therapist's hand movements with their eyes. The therapist moves their fingers back and forth across the client's field of vision, which creates that bilateral stimulation.
I've heard people compare this to REM sleep, where our brains process emotions and memories. Is there any truth to that?
It's an interesting connection, and while we're still figuring out exactly how it all works, we do know that bilateral stimulation plays a significant role in facilitating that deeper processing.
So as the client's following those hand movements, what are they actually doing internally?
They're just noticing whatever comes up, thoughts, feelings, images, body sensations, without judgment or analysis. It's about letting the brain do its thing and reprocess that traumatic memory in a new way.
And the therapist is right there with them through the whole thing.
Yes, absolutely. The therapist monitors the client's distress level, has them periodically rate their distress on a scale of 0 to 10, and we use that to track the progress.
So ideally, as that processing continues, that distress level should gradually decrease.
That's what we're aiming for, to get that distress down to a 0 or a 1, which indicates the emotional charge associated with the memory has significantly diminished.
Got it. And once that happens, what's next?
That's when we move to the installation phase. Now the focus shifts to strengthening that positive belief the client identified earlier. So they hold both the target memory and that positive belief in mind while undergoing another set of bilateral stimulation.
So for Anik, if her positive belief is, I am strong, the therapist would guide her to connect that belief to the memory of the burglary, again, using eye movements or another form of stimulation.
Exactly. The goal is to make that positive belief feel more real and integrated into the client's sense of self. And, like before, the client rates the truthfulness of that belief until it reaches a 6 or 7, indicating a much stronger sense of belief.
It seems like there's a lot of back and forth between the therapist and the client throughout this whole EMDR process.
It is very collaborative. The therapist provides guidance, support, makes sure the client feels safe and empowered, but it's ultimately the client's journey.
Okay, so after installation, what's the final phase?
It's called the closure phase. The therapist helps the client regain a sense of equilibrium, make sure they feel grounded and safe before ending the session.
So it's not just about processing the trauma, but also about ensuring the client feels stable afterwards.
Exactly. And they might discuss any insights or shifts that happen during the session and prepare the client for what they might experience between sessions, because EMDR can sometimes stir things up, and it's important to be prepared for that.
It sounds like EMDR is quite complex.
It is. And while it's gained popularity and recognition as an effective treatment for trauma, as we mentioned earlier, it's faced some criticism and controversy along the way.
Right. I'm curious to hear more about those criticisms.
Okay, well, let's dive into that next.
All right, so let's unpack those different perspectives on exposure therapy then. Where do we even begin?
Well, I think it makes sense to start with the cognitive behavioral perspective since it's so closely aligned with these types of therapies.
Right, because they both focus on like thoughts and behaviors, right?
Exactly. But even within that camp, there are some differing opinions, particularly when it comes to EMDR.
Oh, really? I thought they'd be like totally on board.
Some are, but others argue that EMDR is basically just exposure therapy dressed up with a distracting technique. They acknowledge it can be effective, but question whether the eye movements are really necessary.
I see. So they're skeptical of the whole bilateral stimulation thing.
Yeah.
I've heard that criticism before.
It's a common one, and another point they bring up is that EMDR training became really widespread before there was a huge amount of research to support it.
So kind of like the cart got ahead of the horse a little bit.
In a way, yeah. Ideally, you want tons of solid research before rolling out training for any therapy technique, just to ensure it's safe and effective.
Right, that makes sense. Okay, so what about other perspectives? How do they view exposure therapy?
Well, the psychoanalytic perspective offers a different critique. They argue that while exposure therapies might help reduce symptoms, they don't necessarily address the root of the problem.
So it's like putting a bandage on a wound without actually cleaning it out first.
That's a good analogy. Psychoanalytic thinkers believe it's super important to uncover and work through those underlying unconscious conflicts that contribute to the anxiety in the first place. They might say that exposure therapy just focuses on the surface level without getting to those deeper issues.
It's an interesting point. They're advocating for a much deeper approach that goes beyond just changing behaviors.
They are. And then from the humanistic perspective, there's concern that exposure therapy can feel a bit impersonal, too focused on technique, and not enough on the relationship.
So they're saying it's not just about the method, but also about that connection between the therapist and the client.
Right. They place a huge emphasis on empathy, genuineness, unconditional positive regard. And they believe the therapeutic relationship itself can be incredibly healing.
I can see that. Okay, what other criticisms have been raised?
Well, there's the ethical consideration of intentionally inducing anxiety in clients. Even though it's in a controlled environment, some therapists struggle with that aspect.
I get that. It definitely raises some ethical questions.
It does. And then there's the cultural perspective, which reminds us that we can't view trauma in a vacuum. It's often shaped by these larger social, cultural, and political factors that need to be considered.
So, for example, someone who's experienced war trauma might need more than just exposure therapy to fully address the root causes of their suffering.
Exactly. Cultural critics might argue that these therapies focus too much on individual symptoms without addressing the bigger systemic issues that contribute to trauma.
Right. It's about understanding that individual healing often needs to go hand in hand with societal change.
Precisely. Now, it's important to remember that not all therapists fall neatly into one of these categories. There are also integrative perspectives that acknowledge the value of exposure therapies while also recognizing their limitations.
So it's not about picking one perspective over another, but more about integrating the best of each approach.
Exactly. Integrative therapists advocate for a more holistic view that's tailored to the individual and their needs. They believe that by pulling from different schools of thought, they can provide a more well-rounded treatment.
I like that. Okay, so with all these different viewpoints out there, what does the research say about the effectiveness of exposure therapies overall? Do they actually work?
Well, the good news is there's a lot of research supporting their effectiveness for a wide range of anxiety disorders. We're talking about things like PTSD, OCD, panic disorder, social anxiety, even specific phobias.
That's awesome. So this isn't just some theoretical idea. There's evidence to back it up.
Yeah. Numerous studies have shown that exposure therapies are way more effective than no treatment and often more effective than medication alone for many of these conditions.
That's really promising. Are there any studies in particular that stand out?
Well, meta-analyses, which combine data from lots of different studies, have been especially helpful in showing the effectiveness of exposure therapies, and they consistently find strong results.
So the research is really piling up in favor of this approach.
Yeah.
What about the comparison between different types, like prolonged exposure versus EMDR? Is one better than the other?
Well, it's not so much about one being better, Both prolonged exposure and EMDR have fantastic results, particularly for PTSD. The research comparing the two is kind of mixed. Some studies might favor prolonged exposure a little bit, while others show EMDR to be equally or even more effective.
So it probably depends on the person and what they need.
Exactly. It's about finding the right fit. And, it's also worth mentioning that virtual reality exposure therapy, or VRE, is emerging as a really promising application.
Oh yeah, VRE. I've heard a bit about that. What is it exactly?
Basically, it uses these computer-generated simulations to create really immersive experiences. So it allows people to confront their fears in a safe and controlled environment, which is super helpful for things that are hard to replicate in real life.
Like a fear of flying or heights.
Exactly.
Ah.
VRE gives people a way to experience those situations without actually being in them, which can be a game changer for certain phobias.
That's amazing. Technology is really opening up new doors for this type of therapy. So even with some of the criticisms and ongoing debates, the research seems pretty positive overall.
It is. Exposure therapy has helped tons of people overcome really debilitating anxiety and really take back their lives. And as research continues, I think we're going to see even more innovative applications and ways to refine these techniques.
Well, this has been such an incredible deep dive into the world of exposure therapies. We covered so much, from the history and theories behind it to all the different approaches and perspectives and even the latest research. What a journey.
It has been. And I think one of the biggest takeaways, both for me and hopefully for our listeners, is that healing often requires us to move towards our fears, not away from them.
I totally agree. It might seem counterintuitive, but the evidence is clear. Confronting our fears with the right support and in a safe environment can lead to incredible growth and healing.
That saying, the only way out is through, really applies here.
It really does. And as we wrap up, I'd love for you to leave our listeners with something to think about. After learning all about exposure therapies, how might you approach your own fears and anxieties differently?
That's a great question. How can we take these principles and apply them to our own lives to take steps towards greater courage and freedom?
That is such a powerful question. And on that note, we're going to wrap up our deep dive into exposure therapies. Thank you so much for joining us on this exploration.